A 68-year-old lady who presented to us with atrial fibrillation, systemic inflammation, and a sensation of hurting all over. She had seen many doctors and had been on many treatments, but nothing seemed to work. She came to us as the last resort. See what happened next. So, Camille, let's discuss this 6-year-old lady with atrial fibrillation and really a lot of problems going on, consistent with probably some systemic inflammatory process.
Yes, so she came to our office because of that reason. She had pain in so many parts of her body. She had a condition called interstitial cystitis that causes frequent bladder, pelvic, and back pain. She had really bad arthritis in her knees, nerve pain that affected her ear, so she had to take high amounts of gabapentin. And she also had some pancreatic insufficiency, so some gastrointestinal symptoms, and she felt kind of all over the place and wanted to try something to target everything at once.
Yeah, notice the use of that, suffix itis, right? And so, itis implies inflammation, and so the joints, arthritis, and interstitial cystitis, inflammation in the bladder. And so this patient really had what I would contribute an underlying biochemical fire. And the atrial fibrillation, I would label as an atrial-itis, because I think the inflammation was probably contributing to the heart rhythm abnormality. So quite an interesting presentation. And so what were our findings initially?
So her C-reactive protein was elevated. She had also some high cholesterol, borderline liver abnormalities, and even though we didn't see atrial fibrillation, we saw a lot of premature atrial contractions, so that's just a different sign of inflammation in the upper chambers of the heart.
Yeah, and these premature atrial contractions, these are just abnormal beats, abnormal signals that come from different parts of the upper chamber that electrical signals should not initiate from. And they too can represent irritation of the upper chamber. And I can see how she may have been labeled atrial fibrillation. Oftentimes, doctors who are not experts in interpreting rhythm may see an EKG that shows lots of irregularity, maybe on the cardiac monitor, and then she may get a computer labeling her atrial fibrillation that gets written on the chart and nobody looks closer. But either way, she had lots of irritation in the upper and lower chamber, which again, somebody who has lots of inflammation could very well be having the same thing going on in the heart.
Right. When she was here with us, we did like a very tailored type of meal plan. So the first week it was food level 0, which is just all liquid, organic fruits and veggies. And then the second week we progressed to food levels 0 to 3. So that's raw fruits and veggies, nothing dehydrated yet. Because we also wanted to work on her hydration more in the beginning. And then the last 2 weeks, we added some of the dehydrated plant-based items.
I like the way you use, and we have a food classification system that we use, a novel approach to where we know the extent of aggressiveness of the nutritional regimen. And you mentioned the liquid diet. Many people think of liquid diet when you drink any liquid. It's not just any liquid. These were cold-pressed juices, raw smoothies. There were super nutrients added to them. However, these were specially designed, liquids. And as you progress up the regimen, the food became less hydrating, but still she was hydrated very well in the beginning. So I like that approach, improve hydration, and then progress up that stage. So I think that was quite important in terms of how you use that approach. So what else did we do?
We did some IV infusions consisting of high doses of vitamin C and some other vitamins. And there are some studies that vitamin C improved, arrhythmias and atrial fibrillation. We know it's also a big antioxidant and can help systemic problems. And then we did the ozone. Ozone is in the form of an IV treatment called EBU. And that really helps mitochondrial function. It helps nitric oxide production, and it really helps patients with all sorts of pain syndromes. So she started to see improvement, in her second week.
I like the fact that you point out the benefits at the mitochondrial level, because Many of you, if you've heard of the term mitochondria, all cells have mitochondria. Cells in the brain and the heart have more than cells in other organs. Think of the mitochondria as a battery of the cell. And oftentimes, as our body deteriorates for many reasons, the mitochondrial function gets worse. And the role of the mitochondria is that it takes the oxygen. So we all know we need oxygen to live. The body doesn't use oxygen by itself. It takes the oxygen molecules and converts them to an energy currency that we call ATP, adenosine triphosphate. So there's a certain biochemical reaction that takes, say, and I'll just say hypothetically, 2 units of oxygen, and it may convert it to, say, 17 units of ATP. So when the mitochondria is working as maximum efficiency, 2 units of oxygen will give you 17 units of ATP. However, if the mitochondrial function starts to deteriorate, then 2 units of oxygen may only give you 10 units of ATP or 8 units of ATP. So the oxygenation phosphorylation process, as we may label it, becomes less efficient. So if you do things with nutrition and other biochemical intervention that improves the mitochondrial function, you can get back to converting a certain amount of oxygen to a certain amount of energy. And so that's very important. So this, I think, was very helpful because the more energy a cell has, the better the cell function, the better the cell function, better the organ function. That's the heart, brain, kidneys, whatever cell you're talking about. So that's quite impressive. So what were the other approaches?
We use some targeted micronutrients, so some B vitamins and like alpha lipoic acid, which help nerve pain a lot. We did serapeptase and curcumin to reduce systemic pain and inflammation.
Oh.
And some magnesium to help with the premature atrial contractions.
So you didn't throw the whole sink at it. You were very targeted, very specific, and it was comprehensive. And I always like to say, I like to emphasize, these therapies work together. They work synergistically. And it's important because the body is very complex. And these illnesses that develop over not just years, but decades, become very difficult to treat. So you need a very comprehensive, integrative approach with very close clinical follow-up, which this patient had. So how did she do?
So she did amazing. In her second week, her severe knee pain was gone. She was working out with the trainer here and enjoying that for once, because normally if you have severe knee pain, you're not going to enjoy exercise. And then after 4 weeks, her pelvic and back pain from the interstitial cystitis or bladder inflammation was gone. And she came here having that pain every day, on and off throughout the day. So that really improved her quality of life, and that was what she was most happy about.
Wow, that's impressive. In just 2 weeks. And then 4 weeks, she had more improvement. And this is a patient who had been seeing multiple doctors, over a number of years, and only got worse with multiple medications. But just with the right integrative approach, target, and the right way, and close follow-up, the body can turn around very rapidly. She was able to come off medications and have better quality of life. And that's really the key to overall improving health. So very, very impressive case. I hope you got a lot out of that. And as usual, if you have any questions or comments, leave them in the comment section. And until next time, take care.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.